So a little reminder of what we did last week, and just in case you forgot, well, we just updated you, but we'll just run through what we did last week, just a little reminder as well. And today we're talking about the 5 ways to maintain your heart. I'm going to ask Doc to explain heart disease, heart failure, heart attack. Is there any differences? What should we know about it? He's head of the cardiology department at the University of Ghana Hospital and the Kolibu Teaching Hospital. Good morning to you, Dr. Joseph Akamah.
Good morning, Mama V. Nice to be here again.
Yeah, it's good to see you as always. Yes. You look healthy and nice.
Well, make believe.
All right, but can we just ask in a form of a wrap and a quick reminder what we did last week?
Yes, so I remember last week we talked about the fathers and then how we could keep our fathers healthy, our workers healthy. Women are also workers, but everybody has to be healthy. And last week we talked about learn how to handle stress and take time off work to spend with loved ones. Very key component in trying to decompress, get your stress down. The next one we talked about was increase the amount of fruits and vegetables we eat each day. Our diet is full of carbohydrate and a lot of fatty stuff, animal fat. So we're trying to move people away from that behavior. We also talked about exercise daily, aiming for about 30 minutes at least. Very key. If you want to keep your heart healthy, that is one of the things that you need to be doing. And then we said begin with loss program, and then try to make sure you can cut back on the amount of salt you eat. These two will reduce blood pressure. The weight problem in Ghana is becoming catastrophic. So if you can reduce your weight, it will help a lot. Then we talked about stop alcohol. If you drink, we talked about the bad effects of alcohol. And then finally we said, check your numbers. Make sure you take Father's Day or your birthday. Women take your birthday or Mother's Day and check your blood tests annually. Those who are found to have problems, we can check it more often.
Okay.
So today, like you said, we would like to continue our conversation, looking at the heart diseases and heart conditions.
Yeah, but before that, explain to us heart disease, heart failure, heart attack, cardiac arrest.
Okay. So as you may be aware, the heart is one of the biggest organs that big in terms of importance, not in terms of size, but it's an important organ in the body. Most of us, 85% of us, the heart is on the left side of our chest, right here. About 15% people, the heart is on the right side. But it pumps really regularly, automatically, non-stop. It starts to pump about 21 days after conception. And when the heart stops, everything stops. Because it has to keep supplying blood with the nutrients to the whole body, the organs to continue to function. So the heart has components. If any of the component is disturbed, then we'll call it a heart disease. So for instance, the covering of the heart is called the pericardium. You can have pericardial conditions, inflammation, thickening, or fluid. You can have a problem with the muscle. The muscle of the heart can be disease, weakness, or maybe blood supply issues. That's a heart disease. Or you have the valves. Within the heart, there are 4 valves that regulate the flow of blood. So it literally is a mechanical it's a machine, but it has natural stuff, muscles and valves and other things. So if there's a problem with the valve could leak or the valve could be blocked. That's a heart condition. Then we come to the electrical component, which most people really ignore sometimes, but it is very essential. The conduction system allows the heart to pump as a unit. So the various portions of the heart will function just like a clockwork. So the top portion releases the blood timely to the bottom portion and then to pump it out. So anything that affects these components, we'll call it a heart condition or heart disease. There's a wider one that we call cardiovascular diseases. That includes everything involved in the circulatory system, the heart, the vessels, the veins, and the brain, arteries, stroke, and other things. Blood clogged arteries to the legs, erectile dysfunction for men.
Okay.
So these are cardiovascular conditions. And the biggest player in all of this in Ghana is hypertension.
Okay.
It leads to all of these components being disturbed. So you wanted to find the difference between heart attack, heart failure, and cardiac arrest.
Yes.
These are confusing terms, but really distinct individuals. Heart attack is a situation where the blood supply to the heart is cut off suddenly. So once the blood supply is cut off, that portion of the heart muscle will not get nutrients, will not get oxygen, will not get any supply of blood, and so it will begin to die. The process takes a while, usually up to about 12 hours. So when the heart attack begins, we will notice symptoms that are really dramatic. Sweating, chest tightness, heaviness, and then pain. Sometimes it's not really pain, just heaviness in the chest, discomfort. And the person will be sweaty, vomiting, so dizziness, shortness of breath. So it is a myriad of presentation. But once the symptoms are located in the chest, it's always good to check.
Okay.
What it means is that that part of the muscle will eventually die.
Can it happen in your sleep?
It can. It can. Why can it happen in the sleep? Actually, a lot of heart attacks happen early morning. The reason is sometimes our sleep pattern is not correct. The blood pressure can shoot up. Okay. Early morning, there are a lot of hormones that can be released that can make people have problems. Or you come out, you want to shovel in the morning, you want to do some work, and you are not really prepared for it. And then you exert yourself, that can suddenly lead to heart attack. Or you're in a meeting where there's a stressful moment. Maybe you had to give an account of something, or you had to present at a very tense program. All of these can lead to stress.
So you're not meeting your KPIs.
Exactly. KPIs, everybody. Doctors don't think we need KPIs. Doctors will need to meet our KPIs. KPIs are very essential, especially when you're being annually evaluated, and that can be stressful. That can lead to a heart attack. So sudden surge of energy that you are not prepared for, or a burst of emotion, that can all lead to heart attack. But the biggest thing is that there is a predisposition. You have had cholesterol, high blood pressure, that you build up cholesterol plaques within the arteries that supply the heart.
Okay.
So when you start having chest pain, it's always good to check. Make sure you don't have built up cholesterol within the arteries. That can predispose you to heart attack.
Okay. All right.
The last one, the next one is heart failure. Heart failure is different from heart attack. Heart attack can lead to heart failure.
Okay.
Heart failure is when the heart is unable to pump enough to meet the body's needs. So for instance, the person needs to walk upstairs. The heart will know automatically that I need to increase my output. KPI, talk about KPI. The heart has KPIs that it has to meet. So once it's not able to do that to meet the metabolic needs, then the heart is failing.
Okay.
And the reason could be a lot of reasons. One of them could be the heart attack, weakening the muscle. The biggest cause of heart failure in Ghana is hypertension. So hypertension gradually makes the heart weak. So if you have hypertension, please go check and control it.
Okay.
Heart failure can also be due to infections, like HIV or viruses that can knock out the muscle function of the heart. Heart failure could also be due to dysfunctioning of the valves. There's a condition called rheumatic fever. Due to sore throat, children who get sore throat, even adults who get sore throat that is not treated by a bacterium. Later on, they can infect the heart, and then years later, the heart will come, the valves will become stiff or leaky. That can cause heart failure too.
Okay.
Okay.
Chest tightening.
Yes.
Should we be worried about it? Is it related to any of the things that you've talked about?
Yes. So chest tightening should not happen.
Okay.
The chest should expand.
Shouldn't.
And
Not even in children?
Not even in children.
Okay.
So chest tightening in children, more of infection, more of asthma, more of things that are related to the lungs.
Okay.
Chest tightness in adults, more related to the heart.
Okay.
Okay. Or other causes. So anytime an adult is having chest tightness, go seek help. Let them do an ECG. Let them check your heart thoroughly. Especially if you have risk factors, chest tightening.
Okay. Let's explain chest tightness.
Yes.
Just so if somebody's experiencing it, they'll know that this is what it is.
This is what it is. So chest tightness is a condition where there is a band-like sensation across the chest. Okay, you can't breathe. Suddenly, as if an elephant is sitting on your chest, or if you put your arm around, or someone puts their arm around your chest and it's really compressing, or it could be really a shearing pain, something that you can't cope with, or it could be a sharp pain sometimes, or an annoying pain that you can't describe. Sometimes it's bizarre, but you just feel that there's something there, and occasionally it might radiate. It might go to your jaw, your neck and jaw.
Okay.
It might go to your arm, either arm, but mostly to the left arm. Okay. And typically, there's one that we call angina. Angina is chest tightness or chest pain that comes with exertion. Okay. So anytime I walk, I feel this sensation in my chest. And then I stop, it goes away. Anytime I walk again, I feel it. I stop, it goes away. You should seek help. That means anytime you're walking and the heart has to increase its output, it is not able to meet the demand from blood supply, then it will give you this symptom. Okay. Yes.
Interesting.
Yes.
All right.
So the last one, before you go, is the cardiac arrest. So cardiac arrest, very interesting one, has really been the biggest player in people dying. Okay, suddenly. So cardiac arrest is when the heart stops suddenly for no reason. But there is a reason. Every cardiac arrest has a reason. Okay, so it could be the electrical activity, it could be the mechanical activity, but most often is the electrical activity failing the heart. Okay. Why is this so? It could be as a result of a heart attack. It could be a result of very bad heart failure, a dilated heart that is not functioning. So cardiac arrest is due to heart attacks, is due to heart failure, is due to electrical problems, chemical problems, poisons, renal failure with poisoning of the blood from the renal failure, acid-base disturbance. So all of these can cause cardiac arrest. Okay. And that is when the heart stops suddenly. And the treatment there is to start resuscitation and then shock the heart back to life. Otherwise, the person will not be recovered.
There is an inspirational story that was shared this morning, you know, just minutes before we got into this, into the studio to have this conversation about something that's trending in America. A woman who died like 4 times came back to life, and somebody was asking, how does it happen? Can you be brought back to life? Can you die 4 times and come back?
Well, with God, nothing is impossible. Okay, and we all believe in Him that He is able to do things that we don't know. Miracles do happen. But yes, if you have cardiac arrest, that's really death. So cardiac arrest is a prelude to death. So if you don't stop the person, in 10 minutes, the person will be gone. Actually, less than that. In 4 minutes, the person loses the brain function. So even if you resuscitate the person back, it's likely he's not going to have brain function. But the scenarios differ. How old is the patient? What was his medical condition? Where did it happen? Did they jump on him immediately? Did they shock him back to life immediately? But people have had cardiac arrest multiple times, and they are back to life. Okay. And these days, some are so prone to cardiac arrest, we put devices in them that anytime they die, the machine shocks them back to life. So cardiac arrest will lead to sudden cardiac death. Sudden cardiac death, when that happens, then most often you won't be able to recover. But the woman could have had several episodes of cardiac arrest and was successfully resuscitated. Yes.
Okay. All right. Let's jump on to the 5 things that we should know related certainly to the conversation that we're having today.
Yes. So, how to maintain a healthy heart.
Yeah.
That's what we're talking about. Always check your blood pressure. We had a discussion yesterday at the British Council, and it was very interesting that we all were on the same point, 3 speakers, that Ghanaians have to take charge. We have to take charge. We have to know our numbers. So maybe you start a line, and then we can all follow. What is your number? So if I call you and say, Mama B, what's your number? You know what I'm talking about. What is your blood pressure today?
My number is in my purse.
What is your sugar level? What is your cholesterol level?
I should know that.
You should know it.
Like that.
You know your phone number. You should know it.
Okay.
So we should be tasking each other. I just call you, hey, Mama B, what is your number?
Okay.
Tell me. Then you will know what I'm talking about, your blood pressure. For instance, my number has started going up because I've not been sleeping lately. Okay? So I have to check that number. I checked it twice this morning before getting here. When I go out of here, I'm going to check it again.
How do you check it? How do you check it?
So the blood pressure has to be monitored with a monitor. There are various monitors in the system that you can get, electronic monitors and then the manual monitors. Most Ghanaians feel the electronic monitors are not correct, and it's the other way around. It's the other way around. The machine has to be calibrated. Once it's calibrated and Standard Board authorizes that this is certified, working well, the BP should be measured when you are seated, relaxed, okay, with your arm on the table, almost at the level of your heart. Then there are wrist ones.
Okay.
You remember the one we checked you with the last time?
Yeah.
And there are ones for the calf, the arm. Once you put it on, don't check it immediately. Normally wait for about 5 minutes, relax. Then you hit the button.
Okay.
Then it will give you a recording. It will give you 3 numbers. The top number is when the heart pumps the blood. That's called systolic. The bottom number is the diastolic, when the heart relaxes. Then the 3rd number is how fast your heartbeat is. Okay. If you have a sophisticated one, they can give you more numbers, but these are the 3 basic numbers.
Okay.
So in Ghana, if the top number persistently over a period of weeks is more than 140, then you are classified as hypertensive. If the bottom number is more than 90, you are classified as hypertensive.
Okay.
Both of them are high, you're classified as hypertensive. But why do you need to know your number? Because it increases with time, it changes over time, it changes with emotions, stress, and other things. But if it's consistently going up, assuming you were 90 over 60, young ladies will have 90 over 60, which is fine. It's low, but it's fine for young ladies. But when you are getting to 40, you realize it's going to 120, 130. Then you say, oh, no, there's something going on. If it's consistently going more than 130, you need to seek help.
Okay.
Yeah, so that's why we need to know our blood pressure.
Brilliant.
Yes.
Okay, so know your numbers, which is your blood pressure.
Yes. Your heart rate.
Your heart rate.
Your cholesterol.
Okay.
Your sugar.
Okay.
And if you can, your BMI. BMI is the body mass index.
Okay.
That tells you how heavy you are compared to your height. But among all of this, hypertension is the #1 cause of heart failure, #1 cause of stroke. So we need to know it and then measure and track it.
Okay.
So we can control
so this is a must.
It's a must.
Let's go to point 2. What is
point
the
2
yeah?
Is eat healthy.
Okay.
Eat healthy. What does that mean?
Fruits,
right?
vegetables, greens.
Exactly. And I saw a WhatsApp.
diet.
Somebody sent a WhatsApp, supposedly from US, saying that Menya Ponchi, what did they say? I've forgotten. But you know what that person was talking about?
Yeah.
There's a lot of grass he couldn't eat. And stuff. That's not what it means. What we need to do as a country is to start looking. If you go back to many years ago, our diet was really, really organic and excellent. But over years, we have adulterated the food. We've made fufu fine. We've made banku finer.
Everything is smooth.
Smooth.
Even the cocoa
It's smooth.
It's smooth, yeah.
Okay, so everything has become, somebody said, we've brothalized our food to the extent where as soon as you eat that food, it digests easily and you become constipated. That's number one, because you digest everything. And then you have too much calorie to play with. And then we drive. So what we're saying is that try to balance, cut down how much you eat. If you're eating 2 balls of kenke, cut it down to 1 ball and eat more soup. Of course, kenke and pepper, you can't eat a lot of pepper unless that is what you like. But try to balance it. And then once a while, add more fruits and vegetables, which we don't do in Ghana. We don't eat a lot of vegetables and fruits. Yes. So, if you don't like raw vegetables, it's really good to steam them. So you could steam your cabbage, steam your carrot, and that could be fine because you don't necessarily have to have raw food. But it's just that it is good to eat the fresh vegetables.
Okay. So if you can just toss it a bit.
When you say a bit in Ghana, that'll be one leaf of, but make sure that it's substantial.
Okay.
So,
all right.
And then if you're eating contemporary, make sure it's fresh. It is a lot. I didn't know that our previously made contemporary stew is completely different from
it's
the
different.
current.
It used to be you just do it in the ayuwa
Yes.
and then you pour the oil on it.
Yes.
And then you're good to go. But
Yes.
now we're frying it like proper.
Yes.
Yeah.
And that oil has been used so many times that it loses its value. It has trans fat. That means that it's dangerous. Yes.
All right. So eat healthy.
Healthy.
You shouldn't. It's not only a ponche that eats grass.
No.
And the greens. Okay. Let's go to point 3.
Point 3. Point 3 here says sleep well.
Oh.
Sleep well.
Oh.
Yes. So we lack sleep. Ghana, there's sleep deprivation. The whole country, there's sleep deprivation. Why is it so?
The whole country?
The whole country was sleep deprived. So we have to do something about it. We have to do. You need to sleep about 6 to 9 hours.
Yeah.
Per day.
We've had that, but
Yes.
that's difficult to achieve, isn't it?
Exactly. It is difficult to achieve. But once a while, the weekends, just take time off and rest. Why is it so? The body has something we call circadian rhythm, where the hormones switch on and off depending on whether you're sleeping or awake, especially the stress hormones, cortisol. Very important in regulating your body system, your sugar, your fat deposition. Apart from that, the stress level goes up if you're sleep deprived. So there are other things that we see easily that we can relate to accidents, machine malfunction because the man was not paying attention, he was sleep deprived. Doctors cutting the wrong side because he was sleep deprived. Nurses giving the wrong medication because they are sleep deprived. So all of these are there, but your body, what does sleep deprivation do to it? It's a stress level. The stress hormones go up and every organ is affected by lack of sleep.
Okay.
Every organ. And it's said that sleep is when your body tries to recoup, try to repair, and then make room for the next day. So if you don't sleep well, these functions do not happen.
Is there anything like oversleeping too?
There is something like that, and normally it is when the person is depressed, very lazy, and or they have a medical condition.
Okay.
Okay, medical condition, especially if their thyroid is low, or their hormones, their stress hormones are high or low, depending on what the situation is. But oversleeping is when the whole day you're just sleeping. That is not correct.
Okay.
That's not correct.
So that's also
most
not
often
healthy,
is that can lead to other problems because then you're shutting off your body the whole time.
Okay.
Whether you should be awake. And normally, if you check them, they're mostly depressed, isolated. And so when you see somebody oversleeping, make sure you can encourage them to get out or find out why they're doing so. Maybe it is depression, major depression.
All right.
Yes.
So from sleep well.
From sleep well, we go to make sure to control your numbers.
Okay.
Remember we talked about know your numbers. But now we're talking about controlling the numbers.
Okay.
Why is it important? Many of us take medications without even knowing the number, without getting interested. When the doctor says, oh, it's okay, do we believe him? Do we agree with him? You have to make sure you are engaging the doctor, okay? Sometimes they are busy, and you can imagine one doctor in a district. It's too much. But take time to get to know whether your numbers are getting controlled. So the first instance is to know what is the normal range, what is the target? When should I achieve this target? So blood pressure, cholesterol, sugar, everybody understands that by 3 months, your numbers should be getting controlled.
Okay.
If you're seeing a good doctor. So if by 3 months, your numbers are not getting controlled, they have to make an adjustment. Apart from that, also make sure the side effects of the medication does not throw you off. Because any medicine we take, even water we drink, has some side effect. I'm quoting somebody yesterday. So if you take any medicine and you think that there's side effect and you don't go back to the doctor and you wait till 3 months' time, the disease condition can be really deteriorated and then you have trouble.
Okay.
So blood pressure, make sure the blood pressure stays below 140/90, that's your target. Your sugar stays below 6, that's your target. Your cholesterol, depending on who you are and where you have, your cholesterol levels could be different. A young lady like you with no conditions, cholesterol, I'll say, look, your bad cholesterol, I'll accept 3 to 4.
Okay.
Okay? But once you start having conditions that are high, then I say, no, we need to bring it down. Or if you get older, then I say that 3 to 4 has to come to 1 to 2.
Okay.
See, the level has to drop. Or somebody who gets a heart attack, the bad cholesterol level should be below 1.8. We should go lower on the bad cholesterol.
Lower than 1?
Yes, lower than 1. The lower, the better. So people say, oh, my cholesterol is fine. The doctor said it's fine. Yes, it says on the paper it is fine. But you, as an individual, it is not fine. So always have to individualize your numbers.
Great
So
stuff.
all of these numbers we're talking about can be individually targeted.
Okay.
So in the older folks, we're not too aggressive with the sugar, because if we drop it too low, they can pass out. So we can allow. In the younger people, we're more aggressive because they are alert, they can understand, they can check the sugar, and so we are more aggressive in dropping their sugar.
Okay.
Yes.
On the other hand, there are people who are told to deliberately take in sugar.
Yes. Those are rare. So don't, like one in so many millions.
Okay.
Where
let's
they
not
have,
even go there.
No, they have a condition. It's a hormonal condition.
Okay.
Where they are always low.
Okay.
Another group will be people who are told to take salt, where their BP is persistently low. When they stand up, they feel dizzy. Only then are you told to take salt. And the doctor they can even give you salt tablets to take.
Okay.
So those conditions are very, very rare.
Okay.
Yeah.
All right.
So don't say my blood pressure is low, so I must take sugar. Or I feel like my sugar is low. You don't know. You haven't checked.
Okay.
But if your sugar is low towards the end of the day, what should you do? Go and eat some good food. Don't drink Coke or Fanta or something. That will suddenly shoot your sugar up. And then you have too much calorie to handle. And guess where it goes? It gets deposited and you get pot belly. And then you initiate another round of metabolic problems.
Okay.
Yes.
Let's go to point 5.
Yes.
Let's
Point
go to
5?
Point 5, yeah.
Stay away from, let me see what I wrote here, infections and inflammation.
Okay.
Okay, stay away from infections and inflammation. So what this means, how do you stay away from infection and inflammation? It is really begging the question. But what we need to know is that most of the conditions we suffer from are enhanced or influenced by infections and inflammations. So if your teeth are not very good and you have potholes in your teeth, caries and other things, you have to sort it out. Get the dentist to clean them and make sure they fill them up. Why? The teeth, the mouth has a lot of organisms. And once they get the seed, we call it seeding, Once they seed into your bloodstream, they get into your bloodstream, then they can infect you. And even if they don't infect you, they create an inflammatory condition in your system. Inflammatory condition will lead to cholesterol buildup, will lead to diabetes, will lead to high blood pressure. So inflammatory conditions will lead to those. Recurrent infections. We don't know the cause of, the effect of malaria. We've gotten malaria so much. What is the effect? What is the effect on our body? And we know recurrent fevers due to infection will lead to a persistent system where your ability to cope, your mechanism to cope, your immune system is all distorted. So that is why we brought this up. People don't realize it, but things that will make you have infection, try to stay away from them. GI infections, drinking bad water, having to eat food that is not well prepared, having to eat food that is old. If you got food from a vendor and you kept it outside overnight without refrigeration, even the refrigeration depends on the type of fridge you have. If it's not well prepared, either you discard it or you had to heat it really well to kill the organisms. Otherwise, recurrent infections can lead to a lot of problems.
All right, let's go to the last one, how to maintain a healthy heart. Here's our last point, Doc.
Yes, so avoid prolonged sitting. This point was brought in to highlight a condition that we are really not talking about. Actually, 3 conditions. But the one I want to talk about is clots forming in our legs. So as we sit, the ability of the veins to send the blood back from the leg to your heart is decreased. And when you have blood sitting for a while, it will clot. That's 1. 2, as we sit, we're not people who, our body is such a way that we should not sit too long, because then we will start having problems with our bones. We have arthritis, back trouble, waist trouble, spine trouble. All of these will lead to catastrophic events when we're getting older. And the reason is because you are sitting, when you're sitting too long, then you lead to degeneration in some of the joints. The posture is different. The last one about sitting is obesity. The more you sit, the likely you're going to be obese. The more you sit, you're likely to be obese. And to the extent where some companies in the US now, they allow the workers to stand and work. Or every 2 hours, they let them get up and walk around and come back.
I've seen people who have workstations, apart from your sitting area, they have others that you can stand if you opt for that.
And some, the extreme ones would be you having a meeting whilst exercising. But it's mostly for the CEOs who are capable, right? Me and you, we have to do the work. But the one that I wanted to emphasize on is a clot. So when you are in a car going for a long distance, try to take breaks, 1 to 2 hours. Stop, take a quick walk, and continue. Very, very essential. If you're in a long flight, try to walk along the line.
On the plane.
In the plane. You have to walk from one end to the other one so that you can get your circulation going. Otherwise, we have a lot of people who travel for funerals. They go long distance. And then when they're there, they're not drinking, they're not eating, they're afraid they'll be poisoned. So they are dehydrated. You sat too long. And then when they come back to Accra, they come with chest pain, cough, shortness of breath, and then there is a clot. And sometimes that can kill patients.
I'm sure you've heard about Anansi.
Anansi.
Yeah. Is it related to what you're talking about?
It has some relation, but that's not the clot. Anansi has to do with nerve.
So that's when you either sit for a while, too long, and then you almost feel like you can't move your leg. And
you can't feel it, or it's so painful. And that is normally the clear-cut example is when you sit on a toilet bowl too long and you are about to get up, you can't even move because you've compressed your nerves. On the toilet, the pressure. So please, apart from that Anansi, you are also predisposing yourself to cocoa piles. Sitting on toilet bowl too long, you strain, and then you can get piles.
No,
So
that's the most comfortable place you can be.
yeah, people like it. You can read, you can do
Yeah.
things and stuff. But sitting there too long is not good.
Oh, wow.
It's not
That's
good.
new to
Yes,
me.
it's not good.
Okay.
There are other forms of anansi that have to do with the spine. So if your spine is degenerating, it's why we use our neck a lot. And the potholes have not made it better. But when that happens, you start having anansi in your hands. Those are usually due to pinched nerve.
Okay.
But the classic one you're talking about is due to pressure on the nerve.
Okay.
Yeah.
All right. Okay, so there you have it. Our 5 ways to maintain a healthy heart. Let's activate the phone lines now so you can give us a call. 030221169102, 030221169102. I got a message last week. It was way after our show that somebody really wanted to get in touch, and the person kept trying, but it couldn't come through.
Oh.
Well, you have another opportunity. You can give us a call now. You can talk about what we discussed last week. That's also fine. 030221169102. And this a schoolmate of mine, an old schoolmate of mine, who says she has to step out. So I guess a contact number would do. We're going to give the contact number before we close the discussion, and you know the conversation will also be uploaded. Okay, so here's to all of you who can give us a call right now. Just keep this number and call later on in the day. 0245 708 001, 0245 708 001, and then you can get the opportunity to speak to Dr. Akamah. But give me a call right now on the show, 030221169102, if you've got a question or a comment on the 5 ways to maintain a healthy heart that we've discussed about. Let's stop over at Hohoi. We've got Togbi Tomakba joining us. Good morning to you, Togbi.
Good morning. How are you?
Very well, thank you. Let's hear you, sir.
Yeah, I would like to know the difference, the read about the number as you were saying. Hello?
Yes, sir. You're on air.
Yeah.
You said you want to know the difference.
Yeah, the numbers as it was mentioned about the cholesterol and then the sugar level. Yeah, I just want to know the difference between the cholesterol and the sugar level.
Okay, sure. All right. Doc?
Yes, so if I get you right, you wanted to know the differences. So I'll take the cholesterol. Cholesterol, the difference is whether you are normal or abnormal. And usually, if your cholesterol is going, we have different levels of cholesterol. We have the total cholesterol, we have the bad cholesterol, the good cholesterol. So if your bad cholesterol is more than 2, it is high. But as I said, it depends on who you are. So it could be that your condition is in such a way that 2 is not bad, 3 is not bad.
Okay. So there's no fixed number, really.
It is
after a thorough check,
individualized.
who you are.
Exactly. It's individualized. Right. So don't look at the lab report. Ask the doctor, is this cholesterol right for me, for my age, for my conditions? As for sugar, there is nothing like your age. There is a cutoff point.
Okay.
6. It should not be more than 6.
Okay.
And there's a number we also check called A1C, hemoglobin A1C. That should not be more than 7.
Okay.
If you're diabetic, it should be less than 7.
Okay.
Around. If it's appropriately managed, then your A1C should be 7.
Okay.
Then we're happy.
All right.
Anything above 7, we're not happy.
Okay.
Your sugar more than 6, we're not happy.
Okay. All right.
And then the blood pressure.
Yeah.
Blood pressure, 1 is a higher number. It is in the hundreds. Whereas sugars and cholesterol are in the lower numbers. 2, 3, 4, those numbers.
Okay.
Yeah.
All right. Let's speak to Solomon. Someone is joining us from Bimbala. Good morning, Solomon.
Good morning, Mama V. Please, I didn't hear Dr. Akamah's number well. I don't know if you can repeat it.
I will. When we're done with the conversation. I will,
please,
Solomon.
I want to. Is it also possible to check your liver function test?
Liver function test.
Yes, liver function test.
Oh, liver functioning test. Okay, all right.
Yes.
I'll get him to talk about that. Thank you, Solomon.
Yeah.
Let's speak to Irabna. Irabna is calling us from Takrady. Good morning, Irabna.
Good morning, Mama V. How are you?
Very well, thank you, Irabna. Kindly speak up for us and let's hear you.
Yeah, I'm very glad that you aired this this morning because I've been talking to my husband about all these things and he has not been taking me serious. So coming from the doctor, I think he will take me serious this time. I'm very, very grateful.
Was he watching and listening too?
Yeah, he's here.
Okay.
He's here, and I'm very, very grateful. And he's like, am I a doctor or something? So.
Okay. All right. Thank you very much for the feedback. Ramna Nyame from Takrady. Let's speak to Stephen. Stephen is in Enchi. Good morning to you, Stephen.
Yeah, good morning, Mama.
Yes, Stephen.
I just on my TV and I don't know what you're discussing about, but my father had a problem. Yeah, and I want to.
So what we are discussing is totally related to the hearts.
The heart.
Yes.
Okay. Mine is with what do you call it? Sorry. Okay, I'll call it later.
Okay. All right, Stephen. Thank you very much. There was a call about the liver test.
Yes.
Okay.
So the liver function test you can check. Okay, it's one of the tests that we do at the beginning of your screening. So every Ghanaian, because of the prevalence of liver disease due to hepatitis B and hepatitis C, we advise that once a while, if you never had any blood tests, one of the first tests you'll be doing will include liver function test, kidney function test. And usually we're looking at how is the kidney functioning. Is it, I mean the liver functioning? Are the enzymes high? Are the functioning of the liver in terms of this is the products that it's supposed to produce, like albumin, low? Once your liver enzymes are high, then the doctors will try to find out what is causing the liver enzymes to be high.
Okay.
Yes.
All right. So in summary, what we've done today, how would you summarize all of it and put it in proper context for us before we wrap up?
So in summary, what we are trying to get my fellow Ghanaians and myself to do is to take charge of our heart health. Okay. By knowing that these are readily available things that we can do. It is not very expensive to check your blood pressure. It is not very expensive to check your sugar level. The expensive component is you getting out to do it. That's the most expensive component. But if you walk to a pharmacy shop or any healthcare facility and tell them, I'm coming to check my BP, at most they'll charge you 10 cedis or something like that. They check your BP, write your numbers down. But make sure they check it appropriately. Don't just walk in and they'll start checking it. You have to sit down for a while, let them check it. And you write it down. Now we have smartphones, we can store things for years. And then link it to your Google account or Yahoo account where you don't lose it if you change the phone. So over years, you can know where your numbers are.
Okay.
The next thing is that you should also take charge of your health condition. If you're hypertensive, know that the only way to survive is to know that your blood pressure is well controlled and that the doctor is doing the right thing, the nurse is doing the right thing by knowing your numbers so you can have a conversation. Is my blood pressure controlled today? What is the target? What am I looking at? Is the blood pressure affecting my brain? Is the blood pressure affecting my heart? These are things that a doctor will do intermittently to advise you that your blood pressure is well controlled and it's not affecting you. If you're diabetic, make sure the doctor is doing the right thing. The sugar stays low between 5 and 6. The A1C stays around 7. And that the doctor sends you for eye checks, kidney checks, because diabetes can lead to blindness. It can lead to kidney failure. So these two has to be checked. Your urine has to be checked regularly. If you have high cholesterol, do not believe the number from the lab. Talk with the doctor and say, me, Joseph Akamah, this cholesterol, is it the right number for me or not? Okay. Because it can be variable.
Yeah. All right. Okay. So number specific. Well, what can I say? Those of you who want to get in touch with Doc, well, you know, he's in several places. So find him at Kolibo. You can call Kolibo direct 0244 081 277 0244 081 277. Or you can speak to Clara. Clara will tell you Doc's schedule, and that's 0245 70 8001 0245 70 001. As always, thank you for a healthy Thursday conversation.
Thank you. Thank you.
Did you get the family to take you to the movies?
We went for dinner and a late lunch at a Chinese restaurant.
Yeah.
I was so full.
You couldn't do the movies.
I got a beer and then sleepy, so the movie didn't happen.
Okay.
But it's postponed.
Oh.
So I postponed because I was so tired.
Okay.
I'll go and sleep in the movie house, and that was not good.
So you had a fun Father's
But
Day
I
then.
slept.
Okay.
I slept really well.
That was one of your instructions. So
Yes.
we're happy that you
I
carried
slept.
through one of your own
Yes.
instructions.
I was surprised that I needed that much sleep. Yes.
Okay.
So
All
thank
right.
you.
Thank you. Thank you, Dr. Akamah.
Thank you.